Good day, everyone. I am Sheena Lyle Silagumbay from BMLS 2C, and this is a return demonstration regarding wound care. First, let us define wound care. It refers to specific types of treatment for pressure sores, skin ulcers, and other types of wounds that break the skin. So we have the dry dressing. This prevents the wound from injury and also prevent the introduction and spreading of bacteria, also reduce discomfort and speed healing. The ideal dressing is first, easy to apply. Second, conforms to body contours, durable but flexible, able to absorb or contain exudate, easily removed without damaging the healing surface, and acceptable in appearance. And then we also have the dry woven gauze dressing, the oldest and most common type. It did not interact with any wound tissues and cause a little irritation. The purposes of dressings are first, to promote homeostasis by direct pressure and absorption of drainage. Second is to support and immobilize a body part. The first procedure in wound care is of course the assessment. So we assess the size and location of the wound to be dressed because this assists in planning the proper type and amounts of supplies needed. Second is we ask the client to rate the pain using a scale of 0 to 10. This is because client may require pain medication before the dressing change. So we have the pediatric pain level icon for children. And as for our case, this is a scale of 0 to 10, the adult pain level. Pain level 0 means no pain at all, so the patient may feel perfectly normal. Pain level 1 is a very light noticeable pain. Pain level 2 is a discomforting minor pain. Pain level 3 is a tolerable but very noticeable pain. Pain level 4 is a distressing, strong and deep pain. Pain level 5 is a very distressing, strong and deep pain. Pain level 6 is an intense pain that is strong, deep and piercing. Pain level 7 is a very intense pain. Pain level 8 is a horrible pain. Pain level 9 is an excruciating pain, and pain level 10 is an unimaginable pain. So this pain level is so intense that sometimes the patient may go unconscious shortly. So for example, for the assessment, good morning sir, Melvin Torion, right?
Yes, ma'am.
So let me confirm your birth date, state it with me, March 4, 1996. So are you okay sir?
Yes, ma'am.
So for the size and location, the location of the wound of the patient is on his lower arm. And as for the size, a 2x2 gauze pad is sufficient to dress the wound. And then, sir, if you will rate the pain from 0 to 10, what would it be?
I think it's on level 3.
Level 3. Level 3 is a tolerable but very noticeable pain. And then the next procedure for the wound care is planning. So we assemble the equipment. This is to save time and effort. Our equipment would be first the clean gloves or disposable gloves. Then next is the sterile gloves for the actual wound dressing. And then gauze pad, 2x2 gauze pad. And then plaster that is hypoallergenic. Cotton balls, hydrogen peroxide, and antiseptic solution. Then we have the waste receptacle, which is in color yellow because we are dealing with infectious and pathological waste. Then the next procedure is the implementation. So in this part, there are 14 steps to complete. And then the first step would be we do hand washing. This is to reduce the number of microorganisms in hands. And then second is we position the client comfortably. This is because maintaining client comfort assists in completing the skill smoothly. So for example, sir, I'm already done with my hand washing, so let me position you comfortably. Is it okay for you to sit up or are you comfortable just laying in bed?
Set up, ma'am.
Okay, that's great. Then next is we place the waste receptacle within reach of work. This is to facilitate safe disposal of soiled dressing. The next step is we remove the tape. So pull parallel to the skin toward the dressing. And if over hairy areas, remove in the direction of hair growth. This is to reduce the stress on suture line or wound edges. And then with clean gloves, we remove the dressing one layer at a time, observing the appearance and drainage on dressing. This will determine the dressings needed for the replacement. And the next is we inspect the wound for the appearance, size, depth, drainage, and approximation. This will monitor the status of healing. As for our patient's case, the size is smaller than the previous assessment. And then for the drainage, it is in sanguineous type. By the way, we have 4 types of drainage: the serous, the purulent, sanguineous, and serosanguineous. Serous shows a clear and watery plasma. Purulent is thick, yellow, green, tan, or brown in appearance. Sanguineous is bright red, so it indicates active bleeding, which is in our patient's case. And serosanguineous is the mixture of serous and sanguineous, so it is pale, red, and watery in appearance. The next step is we fold the dressing with drainage contained inside and remove the gloves inside out. This will provide containment of soiled dressing. The next step is we place the dressing tray within reach. This is for easy access of materials. And the next is we apply sterile gloves or use a no-touch technique using sterile forceps. This is to prevent contamination. Nakita sa video the struggle ko. The next step is we apply hydrogen peroxide. This will prevent the transfer of microorganisms from the previously cleaned area. There are 2 things to note when applying hydrogen peroxide. Is we use separate swab for each cleansing stroke, so 3 all in all, and then clean the wound from the least contaminated to the most contaminated area. Next is we apply antiseptic solution. This is to kill microorganisms. We will still use the same technique as for cleansing. Next step is we finally apply the dressing. This will promote proper absorption of drainage. Next is we apply tape. This is to secure the dressing. We already prepared it earlier. That's it. Lastly, after properly removing the sterile gloves, we do hand washing. This is to reduce the number of microorganisms in hands. And then the last procedure in wound care is the evaluation. In evaluation, we ask again the client to rate the pain, and we inspect the wound for at least every 8 hours. This will determine the frequency of applying dressings. And that is it. Thank you.